Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is about neural crest cell migration. We start by a reminder of neurulation. Then we approach the heart of the matter, which is neural cell crest, their migration, and we will deal with syndrome like DiGeorge syndrome, Waardenburg syndrome, Frontonasal dysplasia, and all syndrome linked to Crest cells. We end with the mnemonic of Crest cells. B cell layer. The structure of a bilaminar disc is characterized by a trophoblast with a loss of zone polyphyda, which is important for implantation. Inner cell embryoblast develop another cavity called amniotic cavity. Inner cell mass start to differentiate more with two layers, hypoblast and epiblast. Then the next stage is gastrulation. It is characterized by the structure of three layers with three laminar discs. The process starts with the apparition of primitive strike. Primitive strike is just a thickening in the epiblast layer, which migrates to hypoblast. The structure becomes trilaminar disc called germ layer, the ectoderm at the top, the mesoderm in the middle, and the endoderm neural plaque of the ectoderm get closer. When it closes, it's neural tube. Ectoderm with neural plate border. They come together to form the neural groove, and then they close, giving the neural tube. But neural crest will migrate from this area. The result of neurulation is neural tube giving the brain and the spinal cord, and crest cells giving the peripheral nervous system. The first wave of migration gives sympathetic and parasympathetic, adrenal medulla, and chromaffin cells. Parasympathetic plexus, chromaffin cells, and multipolar neuron. The second wave of migration gives posterior root ganglia, Schwann cells, and satellite cells. Schwann and satellite cells, multipolar neuron, chromaffin cells, parasympathetic plexus. And the final wave of migration gives melanocyte to the epidermis. Neural crests are present in the ectoderm, present in the skin as melanocyte. Some crests scattered around the neural tube, leptomeningia, pia mater and arachnoid mater around the central nervous system. Knowing that dura mater is derivated from mesoderm. Some cells migrate along the side of spinal cord, sensory and autonomic ganglion of cranial nerve, and peripheral spinal nerve. Sympathetic chain or parasympathetic ganglion some of sympathetic glandules fuse together to convert into adrenal medulla. Many cells are scattered in ganglion of GIT, making ganglion in the heart, making ganglion in uterus, around the mesoderm some crest, some facial bone in the neurocranium are derived from neural crest cell. Crest cell make cells, C cells of parafollicular calcitonin in the parathyroid. Odontoblast of teeth, chronotruncal cushion and aortopulmonary septum. A neuroectoderm from the neural tube. First et al. Arachnoid and pia mater leptomeningi, all around the neural system and the neural nervous system. Nota bene, dura is from mesoderm. Number 2, ACE, neuroectoderm diencephalon, outpushing in retina and uvea tract. Number 3, odontoblast of teeth. Number 4, some facial bone. Number 5, C cell producing thyroid calcitonin. Number 6, melanocyte, expansion of crest from ectoderm. Number 7, conotruncal cushion and aortopulmonary septum. Number 8, ganglion sensory and autonomic of peripheral nerve and spinal nerve, sympathetic chain and parasympathetic ganglion. Number 9, adrenal medulla, fusion of sympathetic ganglion, enterochromatin cells. Number 10, Schwann cells are concerned with myelization of peripheral nervous system, versus oligodendrocyte myelization of central nervous system. Endocardial cushion is the aortic channel, is the pulmonary channel, and the conotruncal septum. Many cells are scattered in ganglion of GIT, making ganglion in the heart, making ganglion in the uterus, as the sympathetic trunk and the celiac ganglion, and there is presynaptic fiber synaptin in suprarenal gland. Oligodendrocytes are present only in the central nervous system. It's a type of neuroglia, support and insulation to axon by creating the myelin sheath. A single oligodendrocyte can extend its processes to 50 axons, wrapping approximately 1 micrometer of myelin sheet around each axon. However, Schwann cells of the crest cells coming from the crest cells in the peripheral nervous system, Schwann cells can wrap around only one axon. Schwann cells coming from the crest cells can wrap only one axon. Oligodendrocyte of the central nervous system, they can extend to 50 axons. The anterior neuropore close and 25 days of gestation, and the posterior neuropore and the 28 days of gestation, and neuralization is complete. How to remember that? GO pass. G stands for ganglia sensory autonomic. E stands for endocardial cushion. O for odontoblast. And P, there is 4 P. The first P is pia mater. The second P is parafollicular C cells calcitonin. The third is pigmented cells melanocyte. And the fourth one is pharyngeal arch cartilage. A is about 3. Arachnoid, adrenal, aortopulmonary septum. Only one S, Schwann cells. Crest cells spread everywhere. Smooth cell muscle, osteoblast, osteoclast, Schwann cells, melanocyte, chondrocyte, and adipocyte. Some bone of the face are coming from crest cells. Anomaly in neural crest development cause neurocristopathy, which include frontonasal dysplasia, Waardenburg syndrome, DiGeorge syndrome. Therefore, defining the mechanism of neural crest development may reveal key insight into neurocristopathy. Frontal dysplasia. It's a congenital malformation of the midface. For the diagnostic, patient should present at least 2 of the following: hyperterrorism, an increased distance between the eyes, wide nasal root, vertical midline cleft of the nose and upper lip, cleft of the wing of the nose, malformed nasal, encephalocele, an opening of the skull with protrusion of the brain, or V-shaped hair pattern on the forehead. DiGeorge syndrome, Catch-22. C stands for congenital hair disease. A stands for abnormal facies. T stands for thymic aphasia. C stands for cleft palate. H stands for hypocalcemia. And 22 Q deletion. Waardenburg syndrome, autosomal dominant, partial albinism, old paternal age, deafness, and white forelock. Crest cell, remember? GO, pass. G stands for ganglia sensory autonomic, E for endocardial cushion, O for odontoblast. P, there are 4: pia mater, parafollicular C cell calcitonin, pigmented cells of melanocyte, pharyngeal arch cartilage, and A3, arachnoid, adrenal, aortopulmonary septum. Only one S, Schwann cells. Crest cells. The first one is arachnoid and pia mater leptomeninges, all around the central nervous system. Remember, dura is not from mesoderm. Dura is from mesoderm. Number 2, ACE, neuroectoderm diencephalon outpushing in retina and uveal tract. 3, odontoblast of teeth. 4. Some facial bone. 5. C-cell producing thyroid calcitonin. 6. Melanocyte, expansion of crest from ectoderm. 7. Conotroncal cushion, aortopulmonary septum. 8. Ganglion sensory and autonomic of peripheral nerve and spinal nerve, sympathetic chain and parasympathetic. 9. Adrenal medulla, fusion of sympathetic ganglion, enterochromatin cell. 10. Schwann cells are concerned with myelization of peripheral nervous tissue. Remember, oligodendrocyte is myelization of central nervous system. Frontal dysplasia, congenital malformation of midface. For the diagnostic, patient should present at least 2 of the following: hypertelorism, wide nasal, encephalocele, in shaped hair pattern in the forehead. DiGeorge syndrome, catch-22, congenital hair disease, abnormal facies, thymus aplasia, cleft palate, hypocalcemia, 22 key deletion. Waardenburg syndrome, autosomal dominant, old paternal age, partial albinism, deafness, and white forelock. Crest syndrome, Geopath, ganglia sensory-autonomic, endocardial cushion, odontoblast, pia mater, parafollicular C-cell calcitonin, pigmented cell, parapharyngeal cartilage, arachnoid, adrenal, aortopulmonary septum, and Schwann cells. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.